Afternoon, Dr. Newhalfen here of Northwest Indiana Chiropractic Health. Follow-up video to the Temporomandibular Joint video. As I was speaking to Anna after the video, she brought up something real interesting that I wanted to talk about. And so, Anna, why don't you share your experience with having braces?
Okay, so growing up, I had a really big overbite. So my top jaw left about a gap, maybe a half an inch, maybe, in between my lower jaw and my front teeth. So my bottom jaw would be pushed back and my top jaw, and that's just naturally how my jaw was set. So as I had braces, they had moved my jaw forward so that my molars lined up correctly.
And so this is really, really common, and you know, the orthodontist, you want to line that stuff up structurally, but what it leads to later on is an abnormal, at least in Anna, an abnormal opening of the jaw. So in the previous video, we talked about how when Anna opens her jaw, she comes out like this. And when she pulls her jaw back up, she does the same thing. So if you see, she kind of arcs up and in. And what has happened is, as a result, most likely, you know, you can't say for sure, but most likely, so when they were lining that up, what it did was form a pattern in the brain of how her brain wants her jaw to close. And that pattern never got changed back after the after the braces and the orthodontic appliances. And so what that leads to is it leads to a lot of clicking in her jaw and could potentially lead to headaches, to some degeneration. Because, you know, what happens is, so they aligned her jaw, but now we need to reteach her how to open and close her jaw correctly without this. So we need a nice arcing C and not this protrusive habit that was most likely formed as a result of trying to get her lower jaw to line up with her upper jaw. So really, really common if you've had braces, you know, to still have issues like that in the past, and that is absolutely something we can correct. You know, if you get it eval and we take a look and, you know, that's one of your habits, you know, something we can correct with proper, you know, exercises on soft tissue and home exercises and different rehab stuff. So we just, something we wanted to, and the clicking and the popping as well, that is a result of basically you're hitting bone on bone as the jaw comes out of the socket. And so by properly aligning the jaw, we can also train your jaw to stop all that clicking and popping, you know, a lot of times. So once again, definitely if you've had braces, you know, in the past, definitely I would highly recommend getting checked by a provider such as myself, because, you know, you don't want jaw problems. They can hang around and really, you know, wreak some havoc later on in life. Once again, Dr. Robert Newhalfen, Northwest Indiana Chiropractic.
Cool.